Walking program alleviates chronic lower back pain. From UCLA November 1st, 2024, by Ask the Doctors. Dear doctors, I threw out my lower back 2 years ago while I was helping my cousin move. My back would feel better for a while, but then the pain would always come back. I noticed that since I started a walking program, that cycle stopped. Do you know why that would be? Dear reader, you have discovered one of the many, so many health benefits of walking. As primary care physicians, a large part of our jobs is helping the people we work with to achieve and maintain good health. That makes walking a topic that is near and dear to our hearts. It is easy to consider walking primarily as a means of locomotion, but it does so much more than get us from point A to point B. The process of walking places physical demands on the body that help us not just physically, but also mentally and emotionally. Walking is dynamic, rhythmic, and can easily become aerobic. Whether a gentle stroll or a speedy workout, it engages muscle groups throughout the body. You're practicing balance when you walk and maintaining flexibility. Your lungs and heart are more active, and with every step, you're giving a boost to the movement of lymphatic fluid. Walking helps maintain a healthy weight, improves blood pressure, aids in blood sugar control, and bolsters the immune system. As an added bonus, regular walking has been shown to be effective at improving sleep, memory, and cognition, and also lifting mood and lowering the risk of depression. Due in part to our upright posture, lower back pain is common. Data shows that up to 85% of us will deal with some form of back pain in our lifetimes. As anyone who has experienced it knows, lower back pain can flare unexpectedly, often in response to movement. This can make people leery of doing any kind of exercise, even when recommended by their doctors. The good news is that the vast majority of lower back pain, the estimate is 90%, is temporary. The not so good news is that having had a lower back injury, such as a sprain or strain or a slipped disc, puts you at a risk of a recurrence. And that's where the walking you're doing enters the picture. A contributing factor to low back pain is poor muscular support. This includes not just in the back, but also the muscles of the core. As you walk, you are exercising muscles that help stabilize and thus protect the spine. A recent study looked at 700 adults with chronic lower back pain. Half were asked to walk 30 minutes per day, 5 days a week. They also learned about the mechanics of back pain and strategies for recovery. At the end of 3 years, it turned out that the people in the walking group went twice as long without a recurrence of low back pain as those who did not walk. We hope that even with your back pain gone, you will continue your walking program. Your back and the rest of your body will thank you. Learn why walking can help lower back pain and how it can help you. From healthline.com, 2024. Medically reviewed by Gregory Minnis, DPT, written by Rosalie Rung on June 24th, 2024. Walking might be one of the best ways to help back pain. It can strengthen the muscles in your back, reducing the pain of a flare-up and preventing future episodes. When your back hurts, the last thing you may want to do is move around. However, bodies usually need movement, and walking can be especially helpful for people with back pain. Walking may strengthen your muscles, improve your posture, and stabilize your back. These benefits from walking can be crucial to managing back pain because they might help reduce flare-ups and prevent future episodes. Does walking help back pain? Yes, walking may be one of the best exercises for back pain. It's often especially effective at relieving and preventing lower back pain. In fact, regular exercise, including walking, can reduce lower back pain flare-ups by almost 50%. Walking tends to be most effective at helping non-specific back pain, which is when the pain doesn't have a specific disease or injury to explain it. A 2020 research review showed that walking may be more effective than yoga for long-term back pain relief. However, if you have an acute back injury or other spinal condition, check in with your doctor before starting a new walking routine. Why does walking help back pain? Walking can help with back pain by strengthening the muscles supporting your spine. When you walk, your core, back, and the leg muscles engage and contract to stabilize your spine. Limited physical activity can weaken spinal muscles, which can cause spine misalignment, leading to pain and fatigue. Specifically, walking can help your back pain because it can strengthen muscles and endurance, increase circulation, raise muscle fiber activation, improve spinal movement, reduce muscle tension, boost joint mobilization. Tips for safely walking to help back pain. Proper form and posture are vital for reducing back pain and benefiting from walking. Some tips for appropriate walking form. Hold your head up. Walk tall with your chin parallel to the ground. Straighten your spine. Lengthen your back and try not to slouch or lean forward. Keep your shoulders down and back. Shoulder shrugs can help relax your shoulders. Swing your arms. Move them from your shoulders, not your elbows. Be aware of your feet. Let your heel land first and then transition to rolling off your toes. Wear appropriate footwear. Be sure you have proper foot support and cushion. Avoid overstriding. This can stress your lower leg joints. Are there risks to walking if you have back pain? Walking is generally a low-risk activity and can often help reduce non-specific back pain. However, approaches other than walking may be necessary for the following conditions. Exercise caution if you have an active back injury. A recent strain, sprain, or fracture may need healing time before you can safely exercise. Spinal stenosis. This condition can lead to nerve compression and pain. Walking on irregular surfaces or inclines may increase your pain. Herniated disc. A herniated disc can also result in nerve compression and pain that may worsen when walking. Sciatica. Sciatica pain usually affects your nerves on one side of your lower body. Walking is often helpful for sciatica, but in some cases, walking may worsen the pain. Frequently asked questions. Should I walk if my back hurts? Walking can usually improve your back pain unless you have a recent back injury. However, resting for too long can weaken your back muscles and increase your chances of more back pain. Gentle activities and walking can help you relieve back pain even if your back feels sore. Does walking strengthen your back? Walking engages and strengthens the muscles that support your back, leading to improved stability and reduced back pain. A regular walking routine may help manage back pain. Does walking decompress your spine? Walking can be a great tool for reducing compressed spine symptoms. However, walking alone isn't usually enough to treat it. Other treatments, such as physical therapy, may be more effective. Surgery may be necessary in more severe cases. Takeaway. Walking can be one of the easiest and most effective ways to help back pain, with a few exceptions. Gentle movements such as walking can also benefit nonspecific back pain. Walking strengthens the muscles around your spine, adding stability and helping minimize back pain. Doing it more often can help you manage your back pain, reduce flare ups, and prevent future episodes. How we reviewed this article. Our experts continually monitor the health and wellness space, and we update our articles when new information becomes available. Current version, June 24th, 2024, written by Rosalie Rung, edited by Debbie Nermi, medically reviewed by Gregory Menis, DPT, copy edited by Sofia Santamarina.